Good evening. Cardiac arrest is the leading cause of death in the United States. According to the American Heart Association, almost 90% of all out-of-hospital cardiac arrest patients die. That's an alarming statistic. My name is Andrew Shields. I'm an instructor with the American Heart Association. I've been an EMT for 10 years, and I currently serve as shift commander for Georgia Pacific's Safety and Emergency Response Team. Cardiac arrest can be easily defined as an electrical malfunction of the heart that causes an irregular heartbeat or arrhythmia. This process interrupts the flow of blood to things such as the brain, lungs, and other organs. By working together and following the guidelines set forth by the American Heart Association's Adult Chain of Survival, we can double or even triple a person's chances of surviving cardiac arrest. There are 5 steps in the Adult Chain of Survival. These steps are followed in order of importance. The 5 steps in the Adult Chain of Survival are: number 1, recognizing an emergency and phoning 911. Number 2, early CPR with an emphasis on compressions. Number 3, rapid use of an AED or an automated external defibrillator. Number 4 is early advanced care by EMS. Number 5 is post-cardiac care by hospital providers. The first step in the Adult Chain of Survival is recognizing an emergency and phoning 911. When we approach an emergency scene, we want to first make sure that the scene is safe. What I mean by if the scene is safe is we don't want anything on that scene to be able to harm us. We don't want to become part of the emergency. After ensuring that the scene is safe, when we approach the patient, we want to make sure of 2 things. We want to check to see if that patient is responsive and to see if they are breathing. If the patient is unresponsive and is not breathing, we need to immediately phone 911 because that patient is probably in cardiac arrest. When we phone 911, we'll speak to an emergency dispatcher and answer all of the dispatcher's questions. Doing this ensures that the dispatcher can give EMS our exact location and what resources and equipment that they will need to better serve us. The second step in the Adult Chain of Survival is early CPR with an emphasis on compressions. Imagine the heart as a pump. The pump normally pumps blood to our vital systems throughout the body. When we have an abnormal heart rhythm, that pump can no longer function. So we have to manually compress that pump to pump oxygenated blood to the body systems. The way we manually compress the heart is through chest compressions. We will compress the chest to a depth of 2 inches at a rate from 100 to 120 per minute. After doing 30 chest compressions, we will then give the patient 2 breaths. Those 2 breaths will ensure that the patient's blood remains oxygenated through this process. The third step in the Adult Chain of Survival is rapid use of an AED or automated external defibrillator. The AED shocks the patient and tries to reverse that abnormal heart rhythm so the heart can start pumping again. There are certain steps that we need to take before we use the AED. We need to expose the chest and make sure that no excessive body hair or medical patches exist. If they do, we need to clean and dry those areas before we apply the pads. We then need to turn the power on to the AED. It will provide us voice prompts on how the AED functions and give you steps in providing CPR between AED cycles. The fourth step in the Adult Chain of Survival is early advanced care by EMS. Once EMS arrives on the scene, you will be met with EMTs and paramedics. You need to provide those EMTs with paramedics with an accurate timeline of events and what treatments you have administered to that patient. The EMTs and paramedics will then load the patient onto a stretcher and put them in the ambulance. The ambulance is a clean, controlled environment and where most of the EMTs and paramedics equipment is. They can do advanced procedures inside the ambulance, such as endotracheal intubation. This allows the patient to breathe better. They can do EKGs, electrocardiograms, which can detect what kind of abnormal heart rhythm that the patient has. And they can also have cardiac drugs that can restart the heart if necessary. After the EMTs and paramedics finish their treatment on the scene, they will transport them to the appropriate medical facility that can deal with cardiac arrest. The fifth and final step of the adult chain of survival is post-cardiac care by hospital providers. Once the ambulance arrives at the appropriate medical facility, the EMTs and medics are met by what they call a code team. A code team is made up of nurses and doctors that have special skills and equipment to deal with cardiac arrest. Hopefully that code team can stabilize the patient and arrange for any post-cardiac care that the patient may need to prevent cardiac arrest from happening again. As you have learned, cardiac arrest is a survivable event in a patient's life. In conclusion, by working together and following the guidelines of the American Heart Association's Adult Chain of Survival, which is recognizing and phoning 911 to report an emergency. Number 2, early CPR with an emphasis on compressions. Number 3, rapid use of an AED. Number 4, early advanced care by EMS. And number 5, post-cardiac care by hospital providers. We can double or even triple that person's chances of surviving an event like this. I would encourage everyone listening to take a local CPR program so maybe one day you can save a life. What I will leave you with today is a quote by one of my old fire captains. He told us this at the end of every fire meeting. His quote was, "The life you save today may be your own." What he meant by that was whether we were driving to the scene and wearing a seatbelt or making sure that our scene was safe, we need to make safety a priority in everything that we do. Again, my name is Drew Shields, and I appreciate you listening today.